I feel hip pain continuously. It's like a piercing. I can't sit or stand for long periods of time. I'm not sleeping at night at all. I'm lucky if I get an hour, two hours max sleep, but I'm in constant pain. My name is Norma Kepner. I live in Winter Haven, and I'm here today to have my second hip replacement.
I started feeling pain last September when I'm walking usually. The pain goes down your leg. It starts in the groin area and goes down your leg. I started thinking we really needed to do something seriously when it started affecting my quality of life. My name is Barry. I live in Poinciana, and I'm here today to have my right hip replaced. Joyfully.
My name is Dr. Samuel Messieh. I'm an orthopedic surgeon in Central Florida, serving this community since 1991. I have a passion for hip and knee replacement. It's my life, and it's still an area that intrigues me, and I think we're continuing to evolve and improve and stay on the cutting edge all the time. Hip replacement in general in this country is one of the most common orthopedic procedures, and it's a very successful procedure. With anterior hip replacement, it's a muscle-sparing procedure. We're approaching the hip from the front, between the tensor fascia and the rectus femoris muscles without splitting any muscles. There's less pain post-operatively for the patient, better control of the leg, and they can be up within a couple of hours after the surgery and feel quite well. The length of stay in the hospital has been abridged. We're keeping our patients in overnight, although many of them feel that they could probably go home the same day. Norma's diagnosis is degenerative arthritis of the hip. It's a degenerative process where the cartilage surface of the hip erodes, and it's the most common type of arthritis that afflicts older patients in this country. The surgery went well. It took us approximately an hour, which was what was anticipated, and the fixation of the hip went quite well, so I anticipate that she'll do well when she stands up and takes her first few steps this afternoon.
Fortunately, I've had my right hip done 2 years ago. So when I came into this, I came in with full knowledge of what I was walking into, so I had no fears. I've had no repercussions at all from the surgery or anything. Everyone here has been just fantastic, the healthcare team, so it's been a good experience.
Barry's underlying diagnosis is one of stage 4 avascular necrosis, which is circulation damage to the femoral head. He has collapse of that head as well as complete bone-on-bone arthritis. Barry's surgery went uneventfully. He received digital templating of his hip. There was multiple systems available to address his anatomy. We have processes in place to make these a routine procedure with routine members doing the procedure that have experience with this.
I had my surgery yesterday morning, 24 hours ago. I didn't have any pain. I was able to stand and walk 2 hours after surgery. But the hip pain I had before doesn't exist.
Don came in, the physical therapist, and I thought he was going to have me stand on the side of the bed like they did last time. He stood me up and said, "Now we're walking." So we walked down to the nurse's station and back. And I felt good being with him, and he was very good at what he did.
The physical therapist was very, very, very attentive. He was sure to hold on to a belt that he put on me. We walked down the hall to the room they have with a simulated car.
We did the steps, and he had me getting in and out of a car, which was not done last time.
Showed me how to get in and out of a chair properly.
I mean, the healthcare staff have been very wonderful. They have been friendly. They're very professional in the way they handled the procedure to get me ready for surgery. Everything was explained to me. Everyone spoke to me, talked to me, asked if I had questions. So they're very open, so I would know what was going on. So I had no fear because I knew what to expect, and they helped me feel very comfortable.
I'm very pleasantly surprised at the level of care and astuteness that you get in this hospital. This is a small hospital, relatively. We come from the Houston Medical Center. We were part of the medical center. We lived there for years. And I'm very, very impressed with this place. I really am. The day after I was home, my wife had me vacuum and wash the floors. She said, as long as you have to walk, you may as well be useful. My surgery was 8 or 9 weeks ago, and the scar is a negligible little pink line. After the first week and a half, I did not use my cane. Mostly carry it just for balance if I needed it, but I didn't need it.
My surgery was 7 weeks ago, was June 11th. I felt great. I felt no pain. I don't know, I just feel like I'm back to normal now. I had no additional physical therapy. In fact, I asked Dr. Messieh, I went to see him, I said, last time I had 2 months of physical therapy from the first surgery. And I said, this time, none. And he said, well, because 3 things, you lost the weight, you did a lot of walking, you went in the pool, and he said your muscle tone in this leg was much better during the surgery, so there were no issues to deal with. So he didn't feel PT was necessary.
I'm excited to play pickleball again. I'm excited to exercise again. The surgery has made playing pickleball certainly more enjoyable because I don't hurt and I don't limp like I did.
When I went to my first visit, I said, when can I go in the pool? And they told me the day I go in the pool, I put it in my phone, and trust me, I was in that day. In fact, they took pictures of me going in the pool because I was so excited about being in the pool.
We've always prided in having the best techniques to reduce the potential risk for infection. But during the surgery, to me, that's the most important place out of all that, to also take care and make sure that we're practicing the best sterile techniques and we're doing high volume procedures with regularity so that there's no mishaps. All these are in an effort to help reduce errors.
If I go to a doctor, I expect them to tell me what's wrong with me, tell me what they're going to do, and some of them won't do that, and some of them won't spend the time. Dr. Messieh, to me, is almost a saint. I mean, the guy knows his stuff, he knows what he's doing, he explains it well. A doctor that does that means that they care about practicing medicine and making sure you get the proper treatment and proper care. And that means a lot to me.
My feeling about measuring success is not just with the metrics that we're measuring, which have to do with abridged length of stay, minimal pain usage, and minimal complications, but also exceeding the expectations that the patient has for the procedure and for their treatment. That's how we know we've done a good job if we exceed the patient's expectations.